Have you ever had burning while passing urine that keeps coming back again and again? You take medicines and feel better for some days, then suddenly the same pain returns. This is something many people ignore or treat casually, but repeated urine infections can silently damage your urinary system, and if you keep ignoring them, they may affect your kidneys in the long run. Today we are talking about recurrent urinary tract infections. This simply means repeated urine infections happening again and again, usually 2 or more infections in 6 months, or 3 or more infections in 1 year. This is very common, especially in women, but men can also get it, especially with age. Many people delay proper evaluation. They just take pain relief or antibiotics from pharmacy. They feel better temporarily, but the root cause remains untreated. Now let us understand why these infections keep coming back. First, lifestyle-related causes. Not drinking enough water is one of the biggest reasons. When urine stays concentrated, bacteria grow easily. Holding urine for a long time is another common habit. Poor hygiene, especially after toilet use, can increase risk. Now, diet-related causes. Excess sugar intake can promote bacterial growth. Some people consume very less fruits and vegetables. This reduces natural immunity. Now, medical causes. Diabetes is a very important risk factor. High sugar levels in urine act as food for bacteria. Kidney stones can also cause repeated infections. In men, enlarged prostate can prevent complete emptying of bladder. This leftover urine becomes a place for bacteria to grow. In women, hormonal changes, especially after menopause, increase risk because natural protective mechanisms become weak. Now, drug-related causes. Frequent unnecessary use of antibiotics can disturb normal bacteria. Patients with immunosuppressive medicines are at increased risk. This can lead to resistant infections, which are harder to treat. Young, sexually active women and pregnant women are at higher risk. Now let us talk about what happens in urinary tract infections. Initially, symptoms are burning, urgency, and frequent urination. But if untreated, infection can travel upward to kidneys. This can cause a serious condition called pyelonephritis, which may present with fever, back pain, and vomiting. Repeated infections can damage the bladder lining. In severe cases, they can cause scarring of kidneys, which means permanent loss of kidney function. Now, why do infections recur? Because the underlying cause is not treated. For example, incomplete bladder emptying, presence of stones, or uncontrolled diabetes. Unless these are corrected, infection will keep returning. Now let us understand how doctors evaluate recurrent infections. First step is detailed history. We ask about frequency of infections, symptoms, water intake, hygiene habits, and any associated diseases. Then basic urine test is done. This checks for pus cells and bacteria. Urine culture is very important. This test identifies the exact bacteria causing infection and tells which antibiotic will work best. For patients with recurrent infections, ultrasound of kidneys and bladder is often advised. This is a simple scan that looks for stones, obstruction, or incomplete emptying. Now, the most important part, prevention and long-term control. First, lifestyle changes. Drink adequate water daily, usually 2 to 2.5 liters for most adults. Unless restricted by your doctor, do not hold urine for a long time. Empty your bladder regularly. Maintain proper hygiene, especially in women. Clean from front to back after using toilet. Urinate after sexual activity. This helps flush out bacteria. Avoid spermicidal products during sex. Now, dietary advice. Reduce excessive sugar intake. Include fruits and vegetables in your diet. Cranberry products may help some people. Control diabetes strictly. Treat kidney stones if present. In men, evaluate and treat prostate enlargement. In some patients, low-dose preventive antibiotics may be given daily or just after the sexual activity, but only under doctor supervision, never self-medicate repeatedly. For postmenopausal women, local estrogen therapy may be helpful in selected cases. Remember, prevention is much better than repeated treatment. If you correct the underlying cause, you reduce the risk of future infections significantly, so the key message is get proper evaluation, identify the cause, and focus on prevention. Your kidneys and urinary system are very important, and simple steps can protect them for a long time. If this video helped you understand recurrent urinary infections better, make sure to like this video, subscribe to the channel for weekly education on kidney, bladder, and prostate health. Comment below if you have any questions or topics you want me to cover, and share this video with someone who keeps suffering from repeated urine infections.